To bring in right now to discuss this and more, Kansas Senator, he's also a doctor, Senator Roger Marshall. Welcome into Newsline. Great to see you, Senator.
Bianca, great to be with you. What an exciting day. I just left a meeting with Elon Musk, and he's doing an incredible job over there for the first time in years. I've got more hope in my heart that I'm bullish on America. We're going to figure a way to balance the budget. There's so much waste, fraud, and abuse, and he's doing a great job getting to the bottom of it, saving Americans. I think it'll be $1 trillion when he's all said and done.
Hope is a really good thing, and so is that number you just threw out there, Senator Marshall. Did he have his tech support shirt on that we saw him donning yesterday during that cabinet meeting? A lot of people are saying unelected official, and we go back to what about Anthony Fauci?
Yeah, I won't just describe exactly what he had on today, but it was dark. I do remember that. I think what I would just flip this over and say that what Elon started out talking about was his compassion for federal employees, that those people that have a job that matters, that it's needed, that if they care, if they're competent, we want to keep those people around. But meanwhile, there's so much other fraud, waste, and abuse in there. For example, the Treasury Department issuing checks without people having to fill in what budget line item this was for. So that was ignored by USAID,
outrageous,
amongst others as well. So they're bringing a lot more efficiencies as well. Yes, outrageous.
You've introduced a bill, Senator Marshall, that is trying to ban federal grants for dangerous gain-of-function research, which obviously should have no place after we've all lived through COVID. Donald Trump yesterday, our president, talking about the China virus. The measure that you're proposing actually comes as Chinese researchers say a COVID-like bad virus was just discovered in the same lab. What can you tell us about this bill and why there would be any opposition, even from the left, on this?
Yeah, so once and for all, this bill would ban any federal funding for viral gain-of-function research, no matter how Anthony Fauci wants to describe it. And remember, this viral gain-of-function was Anthony Fauci's pet project for over 20 years. We spent, I'm going to say, $50 billion on this research, helping the Chinese. They ended up developing the COVID virus, which killed 20 million people across the world. We've never seen any gain at all from this gain-of-function research. It's never helped mankind. It's worse, way more dangerous than nuclear warheads are. So it's time to just put an end to it. You know, every 3 or 5 years we hear about a virus escaping from a laboratory, even in America. They're very hard to contain, even in a biosecurity 4-level lab, and we certainly don't need to be teaching our enemies how to grow these viruses, which are perfect for terrorist weapons.
Certainly not. And that's why I alluded to Fauci when people complain about Elon being unelected. And as you well know, the president has Elon there, and he is the commander-in-chief. Let's talk about what he's doing when it comes to health care costs. As a doctor, I know this is something you know inside and out, but he has an executive order introducing action aimed at improving price transparency, directing federal agencies to enforce something he signed in his first term in 2019. We all talk about longevity, make America healthy again. We're spending so much in healthcare, yet people aren't living as long as they are over in Europe, for example, Senator.
Yeah, so transparency, price tags, as I like to call them, is one of the pillars of driving down the cost of health care. When President Trump's first term, we worked with him requiring every hospital to list the prices on different procedures. Maybe 20% of them were compliant with that. We want to make that situation much, much simpler, something that anyone could open up an app, get on the CMS website, and see what every hospital is charging. Let's say you needed your hip replaced. Wouldn't you like to know how much that was going to cost you as well? Maybe you would learn that if you would go to a surgical hospital, it's only going to cost $11,000, but a full-service hospital is charging $40,000 for that same surgery. So let's let Americans become consumers again, even in healthcare. So transparency is the first pillar of making healthcare affordable again. At the end of the day, it's going to help save money for Medicare and Medicaid and preserve those great programs.
Let's talk about Medicaid. One big, beautiful bill. It passed, albeit some nail-biting moments. Donald Trump making some phone calls as they whipped votes over there, the razor-thin GOP House. Now it comes over to the Senate. Speaker Johnson says the Obama-era proposal would make Medicaid more efficient. Obviously, the Senate now will mark up the bill. What changes do you think we will see?
Well, let's talk about Medicaid just for a second. As a physician, half of the ladies I delivered were on Medicaid. I know the program very well. There's not a federal program out there that's more broken than Medicaid is. We've increased the spending by 50% over the last 5 years without anything better outcomes to show for it. Look, we Republicans want to make sure that every American have access to meaningful health care, but Medicaid is not the answer. I think the first answer is expanding community health centers. Maybe we could come back and talk about that sometime. But you talk about an opportunity for Make America Healthy Again to make a difference in people's lives. It would be those people's on Medicaid. Look, 70 or 80% of your health is determined by what's around you. It's what you eat. It's what the water you're drinking. It's the air you're breathing. If you have a job or not is a huge determinant of health care as well. So there's lots of opportunity. We want to make sure that people get the health care that they need, but at the same time, we don't want this money being used for waste, fraud, and abuse. Medicaid will be at $1 trillion here in the next year or two for what we're spending on it. That's unsustainable.
Well, I'd love to have you back to talk about community health centers. It's really important as we look to the younger generation and longevity for people. And you talked about all those things, whether you have a job, access to good health care. And that's an important thing moving forward, I think, as our nation is finally taking some positive steps. I do want to get your reaction real quick in our final moments. There's this measles outbreak happening in Texas. Really tragic that a child has lost their life. The first outbreak in more than 130 people are sick, first in a decade. What would be your advice to people, Senator?
Well, look, number one is get your MMR vaccine. Certainly that's a choice between you and your doctor, but certainly I encourage that particular vaccine. I understand people that are concerned about getting 30 vaccines in a matter of a year, but here's my concern. I told Dr. Fauci this on one of my visits to the border 4 years ago, that these communicable diseases were streaming across the border. I could tell. I visited one of our clinics there full of illegal immigrants, positive tuberculosis tests, and now we have a huge outbreak in Kansas of tuberculosis. That's all on the back of Joe Biden's open borders and Anthony Fauci not fighting the real problems coming across our border. I think the measles, the same thing. I'm afraid that a lot of people have come across that border, never had vaccines, and then those for Americans whose immunity has dropped from the vaccine or never got them, the series of them. I'm afraid that that's the consequences. Very sad we've lost a person here. Measles is a dangerous virus, especially for young children, for the infants as well, and senior citizens, I would suppose, as well. So this is one of the vaccines I think is safe. It's told the test of time. I understand people's vaccine hesitancy. Anthony Fauci did more to create vaccine hesitancy in 2 years than anybody could ever attempt to do in a lifetime. So I understand people's concerns.
Yep.
That's why Bobby Kennedy's committed to radical transparency here to make sure families know exactly what they're getting into.
And you're right, people were just pouring across our border unvaccinated, while people here, Americans, were losing their jobs for not getting certain vaccines. And that tuberculosis even hit New York City schools, some of the most young and vulnerable there. Senator Roger Marshall, pleasure to have you with us today, sir. Thank you for your time and stopping by. I hope you come back soon.